Welcome to my video. Nowadays, depression is accounted to be the #1 reason why people seek mental health services. Some people call it a common code of psychological disorders because it is very common. Statistically, 13% of men and 22% of women can meet the criteria for depression once in their lifetime. So how likely do you have depression? Here, I have 3 simple questions to ask you. Let's go. Before I ask you anything, note that my intention is not to give you a diagnosis, but to give you a general idea of your mental state and how likely you have depression right now. So my question 1 is, within the past 2 weeks, how do you feel before you fall asleep? Especially, do you feel hopeless and discouraged about the future every night, or many of the nights in the last 2 weeks? Do you have a powerful feeling of worthlessness every night, or many of the nights in the last 2 weeks? Do these feelings make it difficult to fall asleep? Let these sink in for a minute. Okay, so question 2 is, within the past 2 weeks, how do you feel right after you wake up? Once again, do you feel hopeless and discouraged about the future every morning or many of the mornings in the last 2 weeks? Do you have a powerful feeling of worthlessness every mornings or many of the mornings in the last 2 weeks? Do these feelings make it hard to get up? Question 3 is, within the past 2 weeks, is negative feeling make up the majority of how you feel in a day? For the people without depression, the default mental state would be positive. But for people with depression, the default mental state would be negative. Any positive feeling would be something extra for them. So if you answer yes to any of these questions, it may be an indicative sign that you may be depressed. And I highly suggest you to fix it as soon as possible. So if you think you have depression, I want you to know that, just like any other pain of the heart, ignoring them will only make it worse. Because of this, I highly recommend you to seek a professional help as soon as possible. And they will first confirm if you really have depression, and then treat you. Depression is treatable, and many people right now have depression, and you are definitely not alone. Or if you want to fix depression on your own first, I highly recommend you to see my next video on depression. This is Kyle and S. Be boundless. Be compassionate.